So today we have Sam Olson. He is a 2-year-old male that presents to the clinic with mom with complaints of pulling at his ears and running fever. She said that it started 2 days ago, that he's been pulling at both ears constantly, and it does seem to be getting worse, mainly at nighttime. She said he's been feeling fussy, not feeling like himself. He's been coughing a little bit, that it's seems to be worse when she lays him down, and Motrin does help a little bit. He does have no allergies. She has been giving him 5 mils of Motrin every 5 to 6 hours. No past medical history, no illnesses or traumas, no hospitalizations or surgeries. He does go to daycare during the day, lives with mom, dad, and his siblings. No exposure to any tobacco products. Upon the review of systems, he does have some fever, decreased appetite and fussiness, some bilateral ear pain, some coughing, been eating and drinking, doing great, having more than 4 wet diapers a day. Last bowel movement was this morning. She does report him having difficulty sleeping at night, mainly because of the ear pain and fussiness. Upon objective and physical exam, temperature is 39 degrees Celsius, blood pressure 95/58, respiration is 25, heart rate 98. He does weigh 28 pounds. He's 2'11". Overall, well appearing. He does look ill, like he doesn't feel good, like he's fussy. Skin's warm, clean, dry, intact. Looking at his ears, both of his tympanic membranes are red, bulging, no signs of drainage or perforation. You cannot see his bony landmarks. Minimal mobility in both eardrums. He does respond to the whisper test, does not exhibit any hearing deficits. CV, regular rate and rhythm, no extra clicks, murmurs, respiratory, symmetrical, lungs are clear bilaterally. So assessment, 3 different differentials: acute otitis media, otitis externa, and then an upper respiratory infection. I chose to go with the differential otitis media because looking at his physical exam, both of his tympanic membranes were red, they were bulging, and with otitis externa, it's the external canal, not behind the tympanic membrane. When you have otitis media, the eustachian tubes that go from like our right here all the way back to our ears, to our tympanic membranes, they can get built up with fluid and clogged, which can cause some of that infection behind the tympanic membranes. So yes, he could possibly have an upper respiratory infection as well that could have contributed to the otitis media. So treatment for otitis media. So first line is amoxicillin. We're going to give him 5 mils PAO, BID times 10 days, and tell mom to continue Tylenol and Motrin. Tylenol 5 mils PO every 4 to 6, and Motrin 5 mils PO Q6 to 8 hours. Just rotate them for fever or pain. Some non-pharmacological recommendations: encourage him to drink whatever he can drink, hydration, some rest, avoiding environmental triggers, and avoiding any tobacco exposure. We did diagnosis with the otoscope, and then other education, just preventing colds and other illnesses that could lead to otitis media, having them sit upright when they feed or drink, getting your vaccinations. And then we have to also think cultural considerations, respecting family structures, acknowledging their spiritual values, and reducing stigma for getting treatment. And then health promotion, we want to tell mom to make sure you complete your entire course of antibiotics, and if they don't get better within the next 48 hours, to follow up with us. No referrals at this time, and to please follow up with us, like I said, in 48 hours. If symptoms do not improve or if something worsens, please call the clinic.